Heart failure is a condition that requires self-management and frequent interactions with the healthcare system. We all know that. So here is a question to think about. If patients with heart failure have high health literacy, do they live longer? Now in JAMA, researchers report on the association of health literacy and all-cause mortality among outpatients with congestive heart failure. The first issue, of course, is how does one measure health literacy? Turns out there are three standard, simple questions that can evaluate that issue. First, how often do you have someone help you read hospital materials? Second, how often do you have problems learning about your medical condition because of difficulty reading hospital materials? And third, how confident are you filling out forms by yourself? Patients were surveyed and followed for slightly more than 1 year. Those with low health literacy were older, had lower socioeconomic status, less likely to have at least a high school education, and had higher rates of coexisting illnesses. In multivariable Cox regression, low health literacy was independently associated with higher mortality. So the next question obviously is, how do we interpret this study? Well, health literacy is clearly not a predetermined static thing and can be modified. Tailoring of educational materials, use of teach-to-goal, an iterative educational process, structured follow-up, and inter-visit surveillance and support can all improve health literacy. An intervention incorporating these elements is currently being evaluated in an ongoing multi-center trial. You will hear more about this in the future, but for now, simply do everything you can to make sure your patients with heart failure really understand what their therapy is all about. They'll probably live longer. I'm Peter Block, and this is a CardioSource Heart Minute.